Hi, I'm Anne, and I'm here to critique the lit review and method section. Some of the good points that Kang et al. Incorporated in the literature review is the use of preset preferences. They identified that only few studies exist that address bleeding in elderlies who use heparin. However, there should be other reasons why they're studying the elderly. Is it because a lot of them are using heparin? Also, showing some pain-related theoretical framework will solidify the study. In the methods section, it was explained that a total of 260 patients were selected in a span of a year. These participants were randomly divided into control and research group. Both groups were compared to show that there was no significant difference between the two. Authors excluded patients who were transferred to another hospitals, those with anaphylactic diseases, and other vascular diseases. How about patients who are taking other drugs that affects bleeding, or other high-risk patients like post-surgical ones? To be included in the study, patients need to have normal platelet results or not to have large ecchymosis and duration. Terms like normal and large need to be measured appropriately to be better understood. To give readers an idea, control group received the traditional way of injection. Steps are provided in the left. Those in the research group received the modified way of injection, which includes hot compression and massage before injection and pinching up of skin after. Some weak points of the methods are the following. Mood of the patients can affect the perception of pain. This is why timing is everything. How long did it take the patients to rate their pain after the injection? These factors are internal validity threats. Moreover, straight-edge method was used in the bleeding assessment, but no definition was provided. There's also an inter-rater reliability issue since it was not discussed how authors ranked the person who rated the bleeding.
Aloha, it's me, Ava. Now it's time to critique the results.
The author randomly divided the participants into a control group and research group for the comparison of pain and subcutaneous hemorrhage. Also in tables 1, 2, and 3 illustrates the difference between the two groups, which shows a statistical significance of less than 0.05. The group that has championed the study is the research group, with less cases of bleeding and pain. The tables were easy to understand and analyze, although the results would have been stronger if the author had indicated which the alpha was set at before they came up with the statistical significance of less than 0.05. Also, the actual computation of the results alpha should have been provided. In addition, a typographical error was evident in Table 3 subheading, which should all be about bleeding. Instead, the keyword pain was written in added confusion.
Hi everyone, I'm Hansel. Now I'm gonna critique the discussion and conclusion. Good point in the discussion section, the authors compared their results with other studies. However, they have some typographical errors which they use the messaging instead of massage, which generates the confusion to understand their discussion. Besides, the results are redundantly mentioned in the last paragraph. Although the discussion was stated regarding the positive effect of the hot compression and massage and vertical needle insertion, however, some of the parts need to be in the lit review section. Moreover, there is a conflict between the modified injection and CDC guideline. The authors apply the injection after pump back, but CDC does not recommend the pullback technique before the subcu injection because it might cause more pain. In the conclusion, the authors stated two limitations of small sample size and different injection time affect the bleeding rate. Besides, they state that multi-center trial is needed, since they chose only one center in China, which is weak point of generalization. There are implications and recommendations for nursing practice, but not for the nursing education and research to address their aim. Although again, they have a spelling error used on conclusion. Overall, the conclusion was not enough to fit with the remainder of the study, which is weak.
The ethics was presented by ensuring the participants' safety and the integrity of the research. Informed consent and approval from the ethics committee are important measures to avoid undue harm to patients, although it would be better if the authors mentioned how they anticipated adverse events and the management of such. Authors also declared that no grants were received, hence no conflict of interest was involved.
So, are we going to decide to change our practice based on the critic of our study?
Modified injection to the nursing practice, it might be a time-consuming work in a busy healthcare setting like hospital. Modified injection needs 3 to 5 minutes of hot compression and massage and 3 to 5 minutes of pinching the skin time, which means including preparing time, total time might be 7 to 12 minutes, which is very long.
This intervention can still be helpful in terms of health education. Patients who take heparin at home or those with caregivers can be taught to do hot compress or massage before injection. The intervention in modified injection were not clearly explained what kind of massage is useful and for how long. How does someone prepare hot compress? As for our final verdict, we rate the study of Geng et al. Weak and decided not to use it in practice. And there you have it. Thanks for listening.